My name is James Boomhauer, and I'm a critical care transport specialist paramedic at Boston MedFlight. We are entitled with treating some of the sickest patients in the state and getting them safely from place to place. Any clinician at Boston MedFlight can essentially do any job. There's very little separation between what a nurse can do versus what a paramedic can do. So it depends on what that call requires, whether I'm getting medical history and taking a report from the sending staff, or I'm helping actually provide healthcare to a patient that requires it, or any amalgamation of the two. It's your team of a paramedic, a nurse, and a pilot, or a paramedic, a nurse, and an EMT in that kind of unified front in whatever you're doing. I'm just fortunate to work with the people I work with. I mean, I have a phenomenal team. I work with some crazy intelligent people that teach me things every single day. And I'm just honored to wear the suit and to be part of the team. We're very fortunate that we have state-of-the-art aircraft. We have a ground fleet, phenomenal medical equipment in every apparatus that we have. That medical equipment is the best in the industry. I think that there are moments in this job where you take a look outside of the view you have of the helicopter or a dimly lit pad at dusk or dawn and say, this is pretty amazing. Every now and then you just take pause and are incredibly thankful for the opportunity to do this work and to help the people that you can help. I really love Boston MedFlight. I think I'm spoiled because this is my first helicopter EMS job. You have an opportunity to work with some of the best equipment and the best tools and the best resources for a mecca of healthcare in the nation. And you have to work really, really hard to get that opportunity and continue to work hard, as we said, on the continuing education front to keep that opportunity, but the reward is great. So if you're willing to put in the time, if you're willing to work really hard, if you're willing to better yourself each and every day, your reward is working for an agency that will give you all of that. So I'm incredibly proud to show that my capstone, my accumulation of all of that work is to work and represent a place like Boston MedFlight is tremendously powerful for me.
Elizabeth Conley. I'm a communications specialist. I've been at Boston MedFlight for approximately 6 years. We take the requests for service, determine what vehicles to send on the transports. We flight follow or monitor the location of those vehicles and facilitate all the logistics in order for transport. This room is commonly referred to as the nerve center. We take all of the information and we disseminate that information as efficiently and accurately as possible, whether it is to our pilots, to the medical crew, the requesting agency, or the receiving facility. Anything that that patient or the medical crew or pilots need from the start of the request until they're back at base, we coordinate in here. On a less busy day, we could average around 400 to 500 calls. During a very busy day, upwards of 800 phone calls. I have always admired Boston MedFlight and air medical transport programs. I've had a love for emergency services and aviation my whole life, just as personal interests. Working for Boston MedFlight combines those interests and is a pinnacle opportunity for me. Not only because it's something I enjoy, but I know I'm making a difference in an area where it's most needed. I am proud to work for Boston MedFlight, and I think when people hear that I work for Boston MedFlight, they think, oh wow, that must be an amazing job, and it absolutely is. You could be making your lunch and get a request for transport of a premature infant, and the very next phone call could be a 100-year-old who's having a medical emergency at a small community hospital. You don't know what you're gonna get, but you're prepared and ready for it when it comes in. The fact that every day is different and every transport and request is different is exciting to me. I enjoy the thrill still of getting to see the aircraft lift off for a scene call, or hearing about a Boston MedFlight transfer on the news the next day, knowing I was involved in that transport and being able to share that with my family.
Mark Saya, critical care paramedic. I've been with Boston MedFlight for 19 years. We transport the most critically ill and critically injured, so there's a couple different types of calls that we do. We do what's referred to as scene work, whereas we are called by the local EMS agencies to come right to the scene of the accident, and we transport the critically injured from the scene of the accident to a trauma center. We also do interfacility transports, where we take the critically ill and injured from one hospital and transfer them to comprehensive hospitals in Boston. I think what sets us apart is our staff. I think my peers are the best in their industry. They're always striving to be the best. I think the services that we deliver, the care that we deliver to patients is unsurpassed. Boston MedFlight being a nonprofit just solidifies that it's all about the patient and all about the quality and not about the bottom line. We at Boston MedFlight know, regardless of a patient's ability to pay or their circumstances, that they're going to get the same care as anybody else. Everyone gets treated equally, and knowing that we are a nonprofit helps solidify that whole approach to patient care. No matter where you go in the industry, across the country, when you're talking about critical care transport in general and you mention Boston MedFlight, some of the comments I've heard is, oh, you're the people who have your act together. I think we're the model. I firmly believe that. I've always felt that way. For 19 years, I felt that we set the bar. People strive, I think, to work towards our quality. There's a feeling of accomplishment. There's a feeling of that you've made a difference in someone's life. And for me, that's what it's all about. At the end of the day, whether it be hold somebody's hand, because sometimes that's all we can do, or comfort a family member, all the way to saving somebody's life. At Boston MedFlight, it's all about how you made the difference at the end of the day, no matter how big or little it was.
Caitlin McGuire. I'm a critical care transport nurse. I transport patients with various teams, whether it be on the ground truck with a paramedic and an EMT, or on the helicopter with also a paramedic and a pilot from the community hospitals, or the scene of an accident. And we're bringing them from those places to Boston to tertiary care. The staff here works on all the vehicles. We work on the helicopter, we work on the ground ambulance, and we work on the fixed wing. It is an extension of an emergency room and an ICU, so everything that can be performed in those places we're doing in our vehicles. It's an interesting dynamic because a lot of times it's you and your partner making crucial decisions in an environment with limited resources. You kind of have this common goal. A lot of times you're fighting till the end, and to see a good outcome afterwards really creates a bond. It's rewarding. It's really rewarding to know that we are making a difference. People come back and tell us that we're making a difference. And sometimes we're just a very small piece of the puzzle, but it still makes the job worth it. It makes the hard days rewarding as well. Doing all the work that someone may need and knowing that you could be making a difference in that moment. I have told family and friends that, I see them at gatherings and whatnot. How's the job going? Do you love it? Do you like it? And I just say, honestly, I feel like it's what I'm meant to do. And people say, I'm jealous. Not everyone can say that about their job, and I realize that.
John Duggan. I'm a communications specialist. In communications here, we intake all the calls for patient transport requests, whether that be by ground or helicopter or airplane. We see those transport requests through vehicle triage, assigning units appropriately ground versus air based on acuity or availability. We also work to facilitate acceptance to facilities, whether it be from a scene provider or a community hospital looking for their patient to be set up somewhere in town. On our main computer, where we're doing all our flight following, we're able to track our vehicles live from batteries powered on to landing and shutting down. We've got a live feed from the weather service where we can be updating pilots when in air. We've got a recorder system where we're able to play back tapes from phone calls or radio transmissions. We've got our rooftop cameras where we're able to monitor safe helicopter operations around the Boston area pads. At our busiest points, we could have 4 helicopters in the air, upwards of 4 or 5 ground calls going on at a time. I am not out flying around. I do not start IVs. I do not do ECMO. But being that first link in that transport is something I'm very proud of. Going home and being able to talk to my wife and my daughter and tell them about the day I've had and feel pride in the work that I do, feel pride in the people that I work with, have a job I can brag about is nice.
My name is Laura Morrow. I've been a critical care transport nurse with Boston MedFlight for the last 10 years. Prior to coming to Boston MedFlight, I worked at Rhode Island Hospital, emergency department in their trauma unit. I also worked in critical care, ICU, post-op. Then I went to a ground critical care transport program. I always wanted to do pre-hospital care, and I always wanted to be out of the hospital taking care of the sickest patients. When I went to nursing school, I had found out somehow that helicopters take nurses out on critical calls, like on the highway, accidents, things like that. And once I found that out, I was like, that's what I'm gonna do. I had always heard about Boston MedFlight, that they were the best of the best. And even when I worked on the critical care ambulance in Massachusetts, Boston MedFlight was definitely the team that you looked at them and you wanted to do what they were doing. As soon as I figured out that nurses could work here, that was my whole goal. Everything that we needed to get here, certifications, classes, whatever, I did it, all within the goal of coming and working as a flight nurse. I have a great job. I actually make a difference. I always forget that. I don't think I do anything different. Sometimes I'm just kind of out there doing my thing, and if I save lives, that's exactly what I'm trying to do. But we're just trying to do the best thing for the patient. It's interesting because I don't feel like a lifesaver or a hero or anything like that. You know, I'm a nurse with Boston MedFlight, and I'm just here to get you out of here and get you where you need to go.
Vahe Ender. I'm a critical care transport paramedic. I work as a paramedic with Boston MedFlight, both on helicopters, the ground ambulance, as well as the airplane. But on top of that, I am involved in multiple different layers of the organization. I'm involved in team clinical development, so I work on writing guidelines, I'm sort of working on new capabilities for the organization. I'm also involved in the simulation team. That is something that I do every other week. My official title there is Simulation Technical Advisor, but effectively my role is to help the simulation group, or a team of 5 people, develop scenarios and adopt those and come up with the technologies to be able to use human patient simulators to either do the initial training for team members here, but especially sort of the ongoing training of the team. Also thinking about the future. So I help write clinical guidelines here, so new protocols to take care of patients, and also think about new capabilities that we want the team to be able to have in the future. There are almost 1,100 medical helicopters in the United States. There are hundreds of flight programs. I only wanted to work here because I was looking for a place ultimately that put the patient first. And this is about as patient-centered of an organization as I can think of at every level. So thinking about the clinical capabilities that we have, we invest in countless capabilities, whether it's taking care of newborns or children and sort of developing that, working on carrying blood or carrying a certain medication, that there's really no incentive from a financial standpoint. We're fundamentally doing it because it's the right thing. MedFlight was founded at a time when HEMS was just getting started, and it was founded on an absolute unwavering commitment to doing everything the right way. And that includes at every level. That means the care that we provide, the helicopter that we choose, the ventilator, and the way that we train people. There's no incentive to do the right thing in this industry. We just do it because we fundamentally believe in it.
I'm Michael Gittleson, critical care transport nurse. I've been with Boston MedFlight coming up on a year and a half now. We are requested from either outlying towns or outlying medical centers or facilities to provide critical care transport that a patient might need above a level of ALS or BLS that's out in the field. What that means is that we bring a wide variety of skills, very specific, very detailed skills, such as providing definitive airways. We are requested out in the field to intubate if a patient's required it for transport. We have a large, pretty much a mobile pharmacy of medications that we can use. We can bring a mobile ICU to a patient who requires that in between transport, and we can get them to a level 1 trauma center fast if they're a trauma patient. I like to say I knew a lot about the organization, but I guess I really didn't know what goes on behind the scenes here. Out in the hospitals, when you're out working, you see the blue suits come in. It's pretty much like seeing the special forces come in. They come in, they do their thing, and they're gone. It's like, wow, it's just like SEAL team that just came in. You don't put a personality to them. You see the blue suits come in, very polite, very pleasant, always taking good care, and you look at them in awe of that skill set, that there's no fear. And I was just looking at it like, I want to get there someday. Coming to Boston MedFlight, I think it met all my expectations, if not more. The people here have been absolutely amazing. I've been welcomed in very well. I've made really good relationships with people here, good friendships, good camaraderie, and good teamwork on calls also. I think Boston MedFlight strives to have the best of the best. They're really good about training you. When you come here, you don't expect to know everything, but Boston MedFlight can teach you what you don't know. And I think that's really good. What sets Boston MedFlight apart is we are ready at a moment's notice, whether it's that person that has that bad luck, gets hit by a truck or a car, or whether it's someone that's really sick at an outside hospital and they just don't have the resources at that place to care for them. We are there at a moment's notice to get them to where they need to be quickly. We have rotorcraft aircraft that we can take, and we cover all of Massachusetts in under 30 minutes. We also have critical care ground ambulances, which are mobile ICUs, where if weather's bad or if the patient doesn't need a helicopter, but we can provide tertiary level care en route there. I'm beyond fortunate to be here. I tell myself, you know, not to sound cheesy, but I'm so lucky to be here because there's millions of qualified nurses out there, and I'm just so fortunate that I was able to have this opportunity.